Hello, this is a virtual pathology specimen of a case of purulent pericarditis. We are looking at a virtual specimen of the heart, and what we are looking at is the surface of the visceral pericardium. And let's have a closer look. We can see that there is a thick yellowish exudate on the visceral pericardium, and this exudate is actually within the pericardial sac. The exudate is composed of acute inflammatory cells and dead cells or necrotic material, as well as fibrin, and sometimes also bacterial organisms. Let's learn a bit more about purulent pericarditis. Purulent pericarditis is infection of the pericardial space with pus or purulent exudates within the pericardial space. Hence, the pericardial fluid, by definition, has to have very high neutrophil counts. Usually, this is caused by bacterial organisms such as pneumococcus as well as staphylococcus. And this can be due to a complication of infection in the thoracic cavity, for example, pneumococcal pneumonia or infective endocarditis. It can also be secondary to hematogenous spread, for example, nosocomial infections in patients with dialysis. And it can also be associated with penetrating trauma to the chest or surgical intervention in the thoracic cavity. And patients who are at risk include immunocompromised patients, for example, patients who are on chemotherapy. Clinically, these patients may present with chest pain and signs of infection such as fever, sometimes dyspnea, cough, and also on auscultation, a pericardial rub. The treatment of infective or purulent pericarditis is drainage of the pericardial sac and also systemic antibiotics. And one of the complications is chronic fibrosing pericarditis, or effectively constrictive pericarditis, which can lead to heart failure. Here is the gross appearance in the specimen that is more fresh, and we can see this yellowish or greenish purulent exudates coating the visceral pericardium, or in other words, within the pericardial sac. These specimens and pictures are taken from Pathweb, which is our free online pathology resource, and you can find the link in this video description. Registration is completely free. With registration, you can fully access our virtual pathology museum. Here I have an example of fibrinous pericarditis in comparison, and we can see that the exudate appears quite similar. And in the fresh exudate, this would appear whitish and somewhat thinner, rather than thick and yellowish or greenish. We also have accompanying talking pots and talking slide videos describing fibrinous pericarditis in our pathology museum. Very briefly, on microscopy, we will see purulent exudates within the pericardial sac, and this, of course, as mentioned, will have a very heavy neutrophilic component, so we can see numerous neutrophils mixed with necrotic cellular material, fibrin, and sometimes also bacterial organisms. There will be a separate talking slide or virtual microscopy demonstration video. And here, just to compare purulent pericarditis with this very dense neutrophilic infiltrates in the pericardial sac versus fibrinous pericarditis, where we can see fibrin deposition with some inflammatory cells, but not as many neutrophils as we see in purulent pericarditis. In summary, this is a virtual pathology specimen taken from our virtual pathology museum, showing a case of purulent pericarditis, where we can see a thick yellowish exudate covering the visceral pericardium or within the pericardial sac, and this is usually caused by bacterial infection. You can also click on the labels to see various annotations and scroll down to see more information as well as annotated gross and microscopy pictures. Thank you.